Thank you, Supervisor Cox. In addition to the resources that are available via the county and via our incredible nonprofit partners for seniors, we want to take this moment to ask every San Diegan to reach out to a senior citizen in their life who they know and check on them. It could be a family member, it could be a coworker, it could be someone you know, but if each and every one of us would simply make a phone call to one senior citizen who we know to see how they're doing, to see if there's anything they need, to give them some encouragement, some support, some help, maybe connect them to some of the services we've just shared, and make sure that they are doing okay. We as a community can continue to remain strong. The burden that we bear on our seniors is obviously much greater. They've been asked to go into a different level of quarantine. They were asked to do it earlier. There also is more danger to our senior citizens in the dangers surrounding coronavirus, and that could create a much greater sense of anxiety and uncertainty. And so the simple act of each and every one of us personally reaching out to someone that we know and offering them some help and assistance would certainly go a long way and be greatly appreciated. Before we get into the numbers for today, a quick update. Tomorrow, the San Diego County Board of Supervisors will convene our regular meeting remotely. While non-essential functions of the county have changed, our county government remains open, and those essential services continue to be provided to the people of San Diego. In addition to several items on our regular agenda, there's two agenda items I would like to highlight for you. The first is in coordination with Supervisor Cox. He and I will be bringing forward a behavioral health impact fund. This is a program we've been working on for many, many months prior to the coronavirus outbreak with Mayor Faulkner and with the city of San Diego. It is essentially taking $25 million that is tied up presently in a lawsuit around redevelopment, distribution, and allocation of funding. And both the city and the county agreeing the dollar amount in dispute between the two of us, the $25 million, is money that, regardless of who might win the lawsuit, ought to go to increase our availability of behavioral health services. If approved by the Board of Supervisors tomorrow, the $25 million will be available and will be out there for service providers, folks who provide drug treatment, alcohol treatment, or mental health services, who have the ability to acquire a building, renovate a building, expand a building, and can demonstrate an ongoing services that we would make a one-time capital investment to try and bring these services online. Given the duration and the lasting impacts of coronavirus, this is incredibly timely now, in that it could provide an opportunity to provide an increased level of services at a time when there may be some facilities, particularly motel services, that may be available. So keep an eye out for that. In addition to the Behavioral Health Impact Fund, tomorrow our County Board of Supervisors will be considering appropriating more than $500,000 in direct contributions to nonprofits that are ensuring food security for San Diego County residents in need. So those are two important actions that we will be considering tomorrow. A quick update on our pledge. We've really seen a tremendous community response from that. More than 10,000 San Diegans have taken the pledge, again, really stressing the vital importance that the month of April presents us and the real commitment we need in the month of April. While we don't have current baseball games on TV, it was great to see the San Diego Friar with an appropriate face covering there, not a medical mask, not a surgical mask, a very creative face covering there. Take the pledge and share. Again, if you go to coronavirus-sd.com/pledge, this is just an affirmative statement that each and every one of us can make to adhere to the guidance and the suggestions that have been put forward. Real quick, before we get into the numbers and the charts for today, we've been asked a number of times in the preceding days if we could provide racial breakdowns for positive COVID cases in San Diego County. The team here has worked hard, starting at 5:30 p.m. today, when our website updates with our chart of what was previously breakdowns by age. We will be including racial data for positive COVID cases. I want to preview you what will be on the website today, but I want to put in context that as of yesterday's number, which is what we will see, 1,326, that was yesterday, we're going to have an update. But out of those, 27% of those, 358, the test results had no accompanying racial demographic data. And so we are not able to determine what they are because the folks who submitted the testing, it was not on there. Out of the remaining ones that did have it, 51% are white, 29% of the positives are Latino, 18% of the positives are Asian, 6% are African American, and 3% are others. This tracks very closely with the broader demographics of San Diego County, but we will begin producing that information on a daily basis in the evenings when our website updates, and we'll continue to keep you apprised of those. Let's jump into our cases by date reported. For yesterday's total, or the total for today, I'm sorry, you'll see an increase of 78 cases, brings us to 1,404 total confirmed positive cases in San Diego County. Our test results, as reported currently, 827. Again, you tend to see these results batched in large batches, and so not a lot to read into the day-to-day totals, but we know that the efforts to increase that continue. The breakdowns in total tests, we're now at 18,490 total tests that have been reported to us, with 1,404 positives, maintaining about the same percentages that we saw yesterday in the percentages of total tests versus positive tests. Next chart breaks down the positives, hospitalizations, ICUs, and the unfortunate loss of life. Again, we're still seeing in most of these a doubling somewhere between 5.2 and 5.6, 5.7, depending upon the category that you look at. COVID-19 outreach efforts, our numbers are up. Nursing triage line up, EpiCalls, hygiene kits, hand washing stations. Number of toilets distributed remains static. As we get more requests, we will fulfill those. Update on motel rooms that are available. We're doing increased outreach with our healthcare system partners to ensure that they know that for every positive individual or PUI who does not feel comfortable going to their home to either quarantine or isolate depending upon their circumstance, that those rooms are available. And we continue to work with the Regional Task Force on Homeless on the role that those rooms play in the regional response to homelessness. Increases across the board in personal protective gear. We're now at more than 1.7 million individual items of personal protective equipment have been provided to our health system partners. And the final chart here, ventilators. All 23 of 23 hospital systems are reporting today. As of presently, we have 537 available ventilators throughout San Diego County. And again, this is not the total number of ventilators. This is the total number of ventilators not presently being used. As it is every day we report, slight uptick in the ones we have on the county who are ready to deploy. And again, we are awaiting arrival of the 125 we have ordered, and we are awaiting an update from the state of California on the 600 that we have requested from them. And that concludes my portion of the report. I'll now turn it over to Dr. Eric McDonald. Thank you.